is over strokes, and I want to go ahead and get started. So our goal is to improve your knowledge on strokes and the effects strokes have of people. The first objective is the students will be able to point out when a stroke is happening by knowing the signs and symptoms of a stroke after the presentation is over. The second objective is of the students in my class, 80% of the students will be able to list 5 programs that help with post-strokes. The third objective is by the end of the PowerPoint, the students will know 6 ways to prevent strokes from this PowerPoint with 83% accuracy. The students will be able to list 6 risk factors of strokes by the end of the lesson with 83% accuracy. What is a stroke? A stroke occurs when something blocks off blood supply to the brain, or it can be when a blood vessel in the brain bursts. It's essentially a brain attack, like the bullet says here. About 795,000 people have a stroke each year. There are 2 major strokes, 2 types of major strokes. I'm going to be talking about those in the next slide. Stroke is a leading cause of death in the United States. Strokes are preventable in most cases. Strokes are treatable in a lot of the cases. I'm going to be talking about that a little bit later on. So there are 2 types of strokes. The first one is hemorrhagic stroke. This occurs when a blood vessel bursts within the brain. An ischemic stroke occurs when a blood clot blocks the blood flow in an artery within the brain. And this just kind of gives you a representation of what it looks like. Overview of population. 1 out of 4 people have strokes that have had previous strokes in the past. You're at higher risk if you have had previous strokes. 87% of strokes are ischemic strokes. Every 4 minutes, someone dies from a stroke. Stroke is a leading cause of long-term disability because it affects the body so hard, because it's the brain, and the brain does everything for the body. So if it's not healthy, then we're gonna have a lot of issues, and strokes can do that. It is the highest death rates in southeastern US. This chart is from the death rate in 2018. The death rate was 242.7 per 100,000 persons age 65 years or older. The people that are 85 years and older had the highest death rates from strokes. Then it was followed by 75 to 84 years, and then 65 and 74, and then lastly 65 and less. The death rates increased with age for both men and women. How does a stroke develop? A stroke develops when a blood vessel carries oxygen and nitrogen to the brain, and it is either blocked by a clot or burst or ruptures. When that happens, part of the brain cannot get the blood and oxygen it needs, so essentially it dies. It is number 5 cause of death. How an ischemic stroke develops. This is the most common stroke because the brain vessels or the brain blood vessels, they become blocked, and they cause to the blood flow to slow down and reduce. This is caused by fats buildup in blood, or blood clots that travel through bloodstream, lodging in blood vessels in the brain. Sorry guys. Stroke by race and ethnicity. Stroke is the leading cause of death for Americans. Strokes are more preventable in Blacks, or more prevalent, I'm sorry. African Americans have highest death rates. Hispanics have increased death rates. The risk of the stroke can vary depending on, if you're white or black or how old you are. Mexican Americans experience greater ischemic strokes. Strokes in women versus men. Stroke has a stronger effect on women. Women have a harder time bouncing back than men do. Women have more stroke events than men. Women are less likely to recover because they're stubborn. They say we're stubborn, and that men are more likely to reach out and get help. Men are normally recovering quicker than women, and men's death mortality rate is higher actually, and the overall lifetime risk for stroke in men has been calculated to be 1 in 6, and then for women it is 1 in 5. Strokes increase by age, so the older you get, the more risk you have of having a stroke. So the mortality rates are super high, like within like 65 and above. Like it says here, it says 70% of all strokes occur above 65 or older. You start to double your risk of having a stroke after the age of 45. Stroke's most common life-threatening effects the elderly. In my opinion, it is going to increase for elderly. Also, last but not least, it can have serious neurological disability among the elderly. There are lots of risk factors when it comes into strokes. High blood pressure, smoking, diabetes, high blood cholesterol levels are a risk. Lack of exercise is a big thing, and high salt and high fat diets are really high risk. I thought that this was a little bit interesting, the diet versus your stroke. Your diet can really play a big role when it comes to, being like scared that you're gonna maybe have a stroke. You really need to focus on your diet. Processed foods can trigger it. Diets and high fats can trigger it. Not enough exercise, poor diets raise your blood pressure. Excess fat can cause major blockages. Obesity increases risk for stroke and hypertension, which also increases your risk for strokes. So, signs and symptoms of strokes. Sudden severe headache with no cause, very sudden confusion, having trouble with your language or understanding speech, having trouble walking. If you are walking and all of a sudden you can't continue to walk, you may be having a stroke. If you lose eyesight in both eyes or have trouble seeing. And then last but not least, sudden dizziness or lack of coordination. And so here I just wanted to kind of show you what that looks like. Facial drooping, this is kind of how you know you're having a stroke. If one side of your face completely like goes numb, your nerves are not working and your eye kind of goes shut like that. You normally are having a stroke on, in this case, he is droopy on the left side, so his right side brain is being attacked. Effects of strokes on the left side of the brain, like I said, if you're having a stroke on the left side of the brain, then it affects your right side body. It can affect speech and language, memory loss. You can become very slow. It can you can struggle with cognitive impairments, making conscious decisions in life. You can have trouble swallowing. And then effects on the right side of the brain, of course, like I said, if you have a stroke on your right side of the brain, then your left side body is going to be affected. So that means paralysis on the left side of the body can happen. Like I said, same thing, speech, you're going to be slow, memory loss. And then this one was interesting, loss of hearing can occur after you have a right side of the brain affected. And then where can you go to get rehabilitation? That involves really intense therapy. You can go into inpatient. This is about 5 days a week, 2 to 3 hours a day. And then also there's outpatient. This is probably about 3 days a week, a couple hours a day. And then there's nursing homes that if it really affects you, then you can go into a nursing home. There's home-based programs. Someone can come out to your home and help you regain, if it's not that severe. And then there's a lot of hospitals that offer therapy. If you just need it after your stroke, you can just call a hospital and they can get you into something. So treating ischemic strokes, you must restore blood flow as quickly as possible. So emergency IV medication, it breaks up clots. And then we have emergency endovascular procedures that improve stroke outcomes. We have medications delivered directly to the brain. Like I said, there's not a whole lot of time when you're having a stroke, because the more time that you can't get in there, then that can really affect the outcome. And then removing a clot with a stent retriever, and then carotid endocardiomyopathy is to clean out arteries. Then angioplasty and stents can also open up arteries to get in there and stop bleeding and all that good stuff. And then treating hemorrhagic strokes, emergency measures to prevent hemorrhagic strokes are more controlling the bleeding and relieving pressure in your brain, because with these type of strokes, you feel a lot of pressure on your head. You can also have surgery to remove the blood or the pressure. There is a surgical clipping that surgeons can do. They can go in and clip their aneurysm and keep it still and keep it from bursting. And then also coiling endovascular embolization blocks blood flow. This is a procedure that uses a catheter and inserting into the groin and attaching tiny detachable coils into the brain bleed to fill it up, to stop it. Then we have surgical AVM removal that helps eliminate ruptures. And then lastly, we have stereotactic radiosurgery. It uses radiation to repair blood vessels. Thank you for giving me your time and letting me present you my presentation. If you need to contact me at all with any concern, questions, comments, my email is right here, and then also my phone number. You can contact me there too.